You're at the kitchen table. The mail arrives. One plain white envelope from the hospital. You tear it open, scan the bottom line. $11,400 for a single afternoon in the ER. No surgery, just scans, fluids, and a couple of stitches. Your stomach tightens. You thought your insurance had your back. Turns out the bill is mostly yours. Deductible not met, coinsurance kicking in, and the hospital's list price somehow survived every negotiation. This isn't a hypothetical horror story. This is 2026 America. And right now, healthcare costs have officially become the #1 money worry for families across the country. Polls confirm it. 2/3 of adults, 66%, are either very or somewhat worried about affording care, including insurance premiums and out-of-pocket hits for visits and prescriptions. That beats out groceries, rent, utilities, everything. Gallup's latest numbers put it even higher. 61% of Americans say they worry a great deal about the availability and affordability of healthcare. It's no longer background noise. It's the loudest financial fear in the room. So how did we get here? Again, and what can you actually do about it without gambling your health? Let's walk through the machine that's quietly draining wallets in 2026. First, the premiums. If you have employer coverage, and most Americans do, a family plan now routinely tops $24,000 a year. You and your employer split it, but your share keeps climbing. On the individual market, the expiration of those enhanced ACA subsidies last year sent many premiums jumping 20 to 30% overnight. Suddenly, the affordable plan isn't. Then comes the real gut punch. What happens when you actually need care? You hit a deductible, on average around $1,800 for an individual, often double that for a family. Until you pay every penny yourself, insurance barely moves. After that, you're looking at 20 or 30% coinsurance on top. One MRI, one unexpected specialist visit, one round of specialty meds, and the numbers stack fast. Here's the part that feels almost absurd when you say it out loud. The prices you see on that bill, they're not set by some neutral market. Hospitals and clinics post sky-high chargemaster rates, sometimes 10 times what insurers actually pay. The insurance company negotiates its own secret discount. You're stuck paying whatever's left after the haggling you never got to join. Add in surprise balance billing from out-of-network doctors who show up during your in-network surgery, and the system starts to feel less like protection and more like a very expensive game of hot potato. Meanwhile, the big picture math is brutal. The US already spends roughly $5.3 trillion on healthcare, about 18% of the entire economy. That's double what peer countries spend per person. Yet our life expectancy and many health outcomes lag behind. Chronic conditions drive 90% of the spending. An aging population, expensive new drugs, and hospital consolidation all push costs higher. Employers are bracing for another 9 to 10% jump in 2026. And when costs rise that fast, someone has to absorb them. Increasingly, that someone is you. The result? Real people making real sacrifices. Surveys show roughly 82 million Americans, 1 in 3, are cutting back on groceries, skipping utility payments, driving less, or rationing their prescriptions just to keep up with medical bills. 41% of adults carry some form of medical or dental debt. That's not abstract statistics. That's your neighbor quietly choosing between the mortgage and the next round of chemo. And here's the quiet irony. We're told we have the best healthcare system in the world. World-class hospitals, breakthrough treatments, the works. Yet one serious diagnosis can still wipe out a middle-class family's savings in weeks. The hype says innovation. The reality says fragility. So what do? You can't wave a wand and fix the entire $5 trillion system, but you can stop bleeding money without skipping the care you actually need. Here's how the people who stay ahead of the curve are doing it right now. Start by treating your insurance like the complicated financial product it is. Open the plan documents once a year. Know your deductible, your out-of-pocket maximum, and exactly what's covered before January 1st. If you're on an employer plan, run the numbers on a high-deductible option paired with an HSA. Those triple tax-advantaged accounts let you sock away pre-tax dollars, invest them, and pull them out tax-free for medical costs. In 2026, with deductibles still climbing, the math often favors people who are healthy most of the year and save aggressively. Next, talk money, out loud with your doctor. It feels awkward, but providers have quietly built in flexibility. Tell them you're paying cash or worried about cost. They'll often switch to a cheaper diagnostic test, choose a generic equivalent, or point you to a lower-cost imaging center. Cash pay prices can be 40 to 60% lower than the insurance route because there's no middleman overhead. Ask up front, what's the cash price? You might be shocked. Before any non-emergency procedure, get a good faith estimate in writing. Federal rules now require hospitals to provide them. Compare prices across facilities using the transparency tools that finally exist. One MRI in your city might run $800. The same scan 30 minutes away could be $2,200. Same machine, same radiologist, wildly different bill. Stay in network religiously. Out-of-network hits still devastate people who assumed my doctor is covered. Use your insurer's provider directory and double-check on the day of service. For prescriptions, always ask for the generic first. If a brand-name drug is the only option, your pharmacist or doctor can often steer you toward manufacturer coupons, patient assistance programs, or even split pills legally to stretch the supply. Build a small war chest specifically for healthcare. Even $50 a paycheck into an HSA or separate savings account changes the game. It keeps you from charging emergencies to credit cards at 22% interest. And if you do get a big bill, negotiate it. Call the billing department, ask for an itemized statement, point out any coding errors, hospitals make them, and request a prompt pay discount or charity care eligibility. Non-profit hospitals are legally required to have financial assistance policies. Many will slash bills dramatically for middle-income families who simply ask. Use lower-cost settings when they make sense. Telehealth for routine follow-ups. Urgent care instead of the ER for non-life-threatening issues. Community health centers and federally qualified clinics often charge on a sliding scale. Preventive care, annual physicals, screenings, vaccines, is still free under most plans. Catch problems early and you avoid the $50,000 surprise later. None of this is glamorous. None of it requires a finance degree. But these small, consistent moves compound. Families who do them report shaving thousands off their annual spend without delaying necessary treatment. Still, there's an uncomfortable truth underneath all the smart hacks. These are survival tactics inside a system whose default setting is expensive. Premiums keep rising faster than wages. New drugs and procedures keep arriving at premium prices, and every year a few more people slip into the medical debt trap. So the question that lingers isn't whether you can trim your personal costs this year. It's whether those trims will still be enough 5 years from now, when the next round of cost growth hits, when another policy shift reshuffles the deck, when one more unexpected diagnosis lands in your mailbox. Healthcare didn't become America's top money worry by accident. It became that way because the numbers finally caught up with the promises. The real game isn't just dodging the next bill, it's deciding how long you're willing to play defense inside a system that keeps changing the rules.